Now let us see in the part 2 of the stroke the pathophysiology and classification of stroke. If you look at the types of stroke, you see that a hemorrhagic stroke or ischemic stroke, and see in this picture you can very well see the hemorrhages on the left side of the picture. On the right side there is an infarct where the clot has stopped the blood supply of the area of the brain, leading to a infarcted area. The pathophysiology, the major cause of cerebrovascular accidents is atherosclerosis, the thrombus formation and the development of the emboli, abnormal filtration of the lipids in the intimal layer of the arterial wall. As you know, it is the component of atherosclerosis, ultimately leads to the plaque development and location of increased turbulence of the blood, that is wherever there is a bifurcation of the arteries. The calcified plaques rupture or there is a fissure, and then ultimately the platelets and fibrin adhere to themselves and leading to a narrowing or block of the artery by a thrombus or the emboli. The transient ischemic attack lead to a temporary focal loss or neurologic loss caused by ischemia of one or the more vascular territories. The microemboli with temporary blockage of the blood flow last less than 24 hours, often less than 15 minutes, mostly resolves in within 3 hours. Warning signs of progressive cerebrovascular diseases. Based on the underlying pathophysiologic findings, we divide the stroke into 3 types, and we have a classification of ischemic stroke, which is further divided into thrombotic stroke and embolic stroke, and hemorrhagic stroke is further divided into intracerebral hemorrhage, subarachnoid hemorrhage, aneurysmal rupture, or AV fistulas or AV malformations. There are certain risk factors. If you see on this table, you find that the list of risk factors which comprises of hypertension, smoking, lifestyle which is sedentary lifestyle, alcohol which also plays a role into stroke, which take into more quantity, hypercholesteremias, raised hematocrit, atrial fibrillation, obesity, diabetes, and carotid artery stenosis, which we have already discussed. All these lead to a cerebral infarction or cerebral hemorrhage, and you can go through this. Ultimately the ischemic stroke, the lumen of the blood vessels get narrowed, and then ultimately it gets occluded. Hypertension and diabetes is associated with more than 60% of the stroke. You can imagine that how big the factors of hypertension and diabetes is playing into the formation of stroke. 50% are preceded by TIA. There are lacunar strokes with development of cavity in place of infarcted brain tissue, results in considerable deficit, motor hemiplegia, contralateral loss of sensations or motor ability. Look at this picture where you will see that there is a thrombus, and also you can see the plaques. The cerebral thrombus is narrowing of the artery by the fatty deposits called plaque, and plaque can cause clot to form which blocks the passage of the blood through the artery. And in this CT brain, you can also see the area of infarction on the left side. And if you see in this picture, you will see that at the bifurcations, because of the turbulence, you find that there is a more chances of formation of the plaques, which ultimately lead to the blockage of these arteries through the formation of thrombus. This is another picture where you will see that diseased carotid artery on the top and the healthy carotid artery at the bottom, and this ultimately prone to get into a stenosis or thrombus formation. Cerebrovascular accident, ischemic or embolic stroke, usually embolus lodges in an occluded cerebral artery, results in infarction and cerebral edema of the area supplied by the vessels. This is one of the second most common cause of the stroke, that is 24%. Emboli originate mainly from endocardial layer of the heart, atrial fibrillation, MI, infective endocarditis, valvular prosthesis. So there is some basic pathology which is going to get the embolus, which gets and lodges into the arteries. Rapid occurrence with the severe symptoms, body does not have time to develop collateral circulation because it's very strikingly fast. Within a minute you will get the patient coming to you with a embolic stroke. It can be any age group. Recurrence common if the underlying cause is not treated. This is another picture which suggests the embolic stroke. Embolus is a blood clot or debris circulating in the blood, reaches to an artery in the brain that is too narrow to pass through, and therefore both the things are playing part into this. One is the plaque formation, another is the thrombus. When we see the hemorrhagic stroke, on the other hand, which comprises of 15% of all the strokes, results from bleeding into the brain tissue itself. It could be into the intracranial vessels, or it could be into the subarachnoid space. These rupture of the intracerebral vessels lead to blood acquisition into the vessels. Hypertension is one of the most important causes. Other things which affects the intracerebral leak is vascular malformations, coagulation disorders, anticoagulation treatment, the trauma, brain tumor, ruptured aneurysms. All these can lead to intracerebral leak. Sudden onset of symptoms with progression of neurological deficit. The important features of intracerebral leak being headache, nausea, vomiting, and hypertension. Prognosis is poor in this particular entity. 50% die within the week, and 20% are functionally independent at the end of 6 months. Cerebrovascular accident, the leak, you can see in this picture how the at the bifurcation of the arteries there could be a aneurysm, or any particular vessels can get ruptured. This is another CT of brain which shows the hemorrhage into the interventricular spaces, and this is in the thalamus. Hemorrhagic stroke, subarachnoid hemorrhage. This is another entity. Intracranial bleed leads into a cerebrospinal fluid, filled spaces between the arachnoid and the pia mater, and on the surface of the brain. Common causes of ruptured cerebral aneurysm may be saccular or Barry aneurysms, comprises 20 to 30 mm in size. Majority occur in circle of Willis. Other causes may be AV malformations, illicit drug abuse. Incidence is 6 to 16 per 100,000. Increases with age, more common in women. The warning symptoms of cerebral aneurysm may be sudden onset of severe headache, worst headache of one's life, change of pressure in the brain, neurological deficits. Now you see this picture, there is showing a aneurysm, and there is a catheter which is by which you can take an angiogram and look for the aneurysm, and surgical treatment is one of the options in treating these particular entities, and you can clip the aneurysm and prevent the rebleed, right? Immediate surgical intervention is required. This is another Barry aneurysm where you are putting a clip, and this is another picture suggestive of the same. The principal features of destructive cortical lesions, if you see the whole summary of the different lesions and different areas where the lesions are into the frontal lobe, or the temporoparietal lobe, the parietal lobe, or the occipital lobe. So you can go through the different types of deficits which you come across during the phase of localization of the lesions in different areas.